Discover the power of functional medicine. With over 25 years of experience in functional medicine, family nurse practitioner Dr. Durrell has been preventing and reversing chronic disease, helping you live your best life.
Hey everyone, this is family nurse practitioner Dr. Durrell here at South Florida Integrative Health Center with the Power of Functional Medicine podcast. Today, we're talking about cholesterol. Is it really the villain? And we know things aren't always just good or bad, and we also know that there's good cholesterol and bad cholesterol. But how do we test for the risks for heart disease? Because after all, that's what we're speaking about is heart disease. It's the number one killer, heart attacks and strokes. And that's why we want to know the root cause, the underlying causes, but more so, how do we test for these risks? And this is where the topic of cholesterol comes in, because just knowing that number and driving it down as low as possible isn't the only answer. There's so many underlying causes, and this is where functional medicine, the power of functional medicine, asks why. And so let's go and discuss cholesterol today. So this article really discusses the types of testing that are going to be important, and where we're getting to underlying causes are these remnant cholesterol. If you see in the title of this article, remnant cholesterol is speaking about the particle size and the particle number. And that is what we used to call the bad cholesterol, LDLC. And the newest one was ApoB. But it's even better to measure the remnant cholesterol, which is known as particle size, and the different sizes of the cholesterol. And that's where we're going to see on the different testing, such as this test here, you'll see that there are different sizes, small, medium, and large. And although the total number can be in red and it can be what's considered above the limit that's recommended, but what are the sizes of the particles? Those are the remnant lipoproteins, the more the clogging of the artery type of cholesterol. And this is what we want to test for. And as you see here, the medium and the small and the large are in the yellow. They're in the warning, the caution. And many people are in this range. They're not at the one end of cholesterol, which is very acute. And there is better testing now of looking at these arteries. But until then, in this range that most people are at, where they're on this spectrum of heart disease, the beginning of the hardening of the arteries, where you get the soft plaque and the hard plaque, part of that, the best way to measure it are these small, medium, and large particles. And on another lab, we're going to see that this way of it being measured, you'll see LDLP, which is the particle number, but you'll also see particle size, small, and the HDL is the good cholesterol, HDLP. So this test actually measures the amount of the particles and not just only a calculation, which is what LDLC is. It's simply a calculation. So you see there's so much more than just a cholesterol number that can start letting you know about the risk, because the smaller the particles, the more risk there is. And you want larger particles. And that's why HDL is beneficial, the HDLP. You want a larger number for those, but you want a smaller number of the small particles. And so what are these underlying contributors, these underlying root causes for heart disease, that where it's just not only the cholesterol? And that would be, as you see in this article, it's oxidized cholesterol. And what makes oxidized cholesterol? As you see here, it's inflammation. What causes inflammation is activation of the immune system. So you really want to get to these root causes, these underlying causes of heart disease. This is where it's not just cholesterol. And as you see, scrolling underneath here, underneath the article, you see some of the top reasons. And you see insulin resistance as number one, these ups and downs of insulin. And the continuous glucose monitors, they might tell you your glucose, but they're not telling you your insulin. It's so important to know and to control these ups and downs of insulin. Elevated levels of insulin, whether it's insulin resistance or other reasons, can be very much an underlying contributor to the hardening or the blocking of these arteries. And the other factors are listed here: cortisol. And these are things that we're really getting to the root cause, underlying contributors in functional medicine. The reason why we get good results is we combine functional medicine, these root causes, and primary care, which means getting the best outcomes and preventing and even reversing these chronic diseases like heart disease and of course diabetes and metabolic liver disease, which was called fatty liver. Many things can be helped through lifestyle medicine, food, nutrition, and many of these root causes. Cortisol is the next one for one of the contributors for heart disease, these ups and downs of stress hormones. And so we measure and we improve cortisol levels. And I mentioned before that we improve insulin levels. The next one is thyroid, a sluggish thyroid, a subclinical hypothyroid, where it's not at the level of a disease, but it's still on the lower side. And we're going to optimize thyroid hormones, optimize hormones. Testosterone, estrogen can affect cholesterol, these types of bad particles, these small particles, these remnant lipoproteins. So we want to optimize hormones. You want to also optimize vitamins and minerals and amino acids and very much important, essential fats, the good fatty acids. These are all what we're doing in functional medicine. And as well, what's very important, as you see there scrolling underneath the screen, there are toxins. Toxins such as mold, heavy metals, and these forever chemicals that we can test for and assess if a person is having higher levels than what we want in these toxins. So, and one of the most important ones is gut overgrowth. And I'll show an example here of a test that we have here for gut overgrowth. And let's see here. Here it is. The gut overgrowth, as you see, now this can make lipopolysaccharides. When these overgrowths of what they're called are opportunistic, they're not pathogens, they're not dangerous in the fact that they're normally in our gut, but when they overgrow, they can produce these lipopolysaccharides, which those are inflammatory molecules, inflammatory. They produce inflammation, which can then irritate the arteries, and that's what they call endothelial dysfunction. So that irritates the arteries. So it's so important. And this is done on a stool test. It's not a blood test. So the best functional medicine, what we do at South Florida Integrative Health Center, is combine blood testing, advanced blood testing, with this advanced stool testing to see if there's an overgrowth of these opportunistic bacteria, like you see here, an overgrowth of Citrobacter and Staphylococcus and Streptococcus, which can be inflammatory and can really contribute to heart disease. So what you see then are many more factors contributing to heart disease than cholesterol. And so functional medicine combines the best of primary care and getting to the underlying root causes, which is functional medicine. The power of functional medicine is asking why and getting to those underlying contributors. So please like and subscribe. Stay tuned for our future podcasts. And everyone, remember, it is important to ask why, and remember the power of functional medicine. See you next time.